speaking. To start off, we have Stanley Richardson. He's a Gainesville Poet Laureate. And in addition to being a renowned poet, he's an actor, a playwright, and a social political commentator, as well as a lecturer. So welcome. We also have Father Alan Bauer, who is the UF Shands chaplain. He's outreach preacher for the Cross Catholic Outreach and was previously a command chaplain for the United States Marine Corps, and he served 28 years in the Navy. We also have Reverend Sharon Austin. She serves in Connection Ministries for the United Methodist Florida Conference. In 1986, she participated in the 54-mile walk from Selma, Alabama to Montgomery, Alabama with Congressman John Lewis. We also have with us Dr. Brent Harrell, who is an assistant professor of medicine at the Department of Family Medicine at the University of Florida and director of the Mobile Outreach Clinic. We have Dr. Peter Carrick, professor and chief of family medicine, who has been instrumental in increasing UF Health's presence on the east side of Gainesville. He's dedicated his career to improving the quality of patient care. And finally, we have proud to announce Dr. Fred Southwick, who's a professor of medicine and the chapter leader of the Gainesville Right Care Alliance. And so I'd like to turn it over to Mr. Stanley Richardson.
Well, thank you. Thanks again for inviting me to this forum. I was talking to Dr. Fred, and I explained to him he apparently is a lover of poetry. His sister is a creative writer and a poet, so he asked me to share some poetry this evening to kick this off. So I was talking earlier that last month I was contacted by the Florida League of Women Voters to assist them in their statewide media effort to expand, bring awareness to the need to expand Medicaid. So they asked me to write a poem about Medicaid expansion. So I got being the Alachua County Poet Laureate, I got the okay from the Alachua County administrators that I could, go ahead and do that, and they would back that. So I wrote something, and I'm gonna share it here today. So you'll be my test audience. So and you can let me know if you dig this or not. So Florida is one of 13 states yet to expand Medicaid. Over 1 million low-income uninsured adults would receive health insurance if through Medicaid expansion. So just a little bit of data. So here we go. Ba-da-doo bop, bop bop, ba-da-doo ah. Ba-da-doo bop, bop bop, ba-da-doo da. Ba-da-doo dop, bop bop, ba-da-doo da. Make me want to holler, throw up both my hands. Make me want to holler, throw up both my hands. Mother, mother, there are too many of you crying. Brother, 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 there are far too many of you dying. You know we got to find a way. My country, 'tis of thee, sweet land of liberty, of thee I was thinking, if the poet sings, will it make the suffering more real? If I composed a concerto instead of a poem, arranged an orchestra, put the pain to music, could you then feel the rhythm scream? If I resurrected not the Son of Man, but Marvin Gaye, Bo Diddley, Tom Petty. We sat in a holy circle singing Willie Green's blues. My baby ain't got no shoes or health care. Would you then dare to care? But the poet. The poet doesn't sing the poet poems as did the prophets to the kings. When COVID came, a plague marching its a cappella death song laid bare our ugly underbelly, rolled us over onto our exceptional systemic side, showed the world how we live, how we die, how we fall through huge gaping holes that you consider cracks. Show the world how we live, how we die, disproportionate, essential, less privileged, workers, indigenous, black and brown, the other side of town, redlined over eons, stacked like tuna in a tin, unable to escape death's breath. Its 6 feet tentacles when COVID came knocking at our toil and scuffle. This ain't living. Ghost of the uninsured, gone too soon to woe and dust, haunt us from the other side of soup lines, just below the poverty index. Give us health care. Give us health care. Expand Medicaid. Give us health care if you care. If you care. If you care. To have no concept of terror. To have no concept of terror, the sickening unknown, what holds tomorrow, today made all too real. The cost of your child's next meal weighed against the price of a pill. To have to choose is horror. Something heavy, thick and wicked this way wails in the halls of injustice, just outside the lawmaker's chamber. You severed your soul to spite your neighbor's getting. Righteousness wails in disbelief. Citizens poor, sick, and dying petition powers for relief. Brazen neglect a life of grief. This ain't living. Give us health care. Give us health care. Expand Medicaid. Render us aid. Give us health care if you care. If you care to do the human thing, the good thing, the right thing. Empathy, decency is all that is required. Without politics, without political party, partisan antics, without debate or hate, without despise peering through racist eyes, though I fear therein lies the rub. Thank you.
That was really terrific. This is Dr. Fred. Jeff, I think I will let Sharon will be presenting next. Somehow she didn't get the link to be the presenter, so I'm going to allow her to talk now. Sharon?
Yes, Dr. Southwick.
Yes, good. So we'd like you to say a few words now.
Thank you very much. I'm very grateful for the opportunity to just share a word regarding awareness of the healthcare disparities that have been highlighted during COVID, but have been in existence long before COVID. There have been a number of studies that address the inequities in healthcare. Among them, my interests have really increased along the lines of Black women and infant mortality. And so there are statistics which have pointed out the fact that Black mothers are 243 times more likely to die of complications of a pregnancy than their white counterparts, that Black people were 3.6 times as likely as white people to have their legs and feet amputated as a result of diabetes, even when other factors were equal, and that cesarean sections were 40% more likely among Black women compared with white women. Now, this information was actually a part of a New York Times article written by Linda Villarosa, and she pulls her statistics from an article entitled Unequal Treatment, Confronting Racial and Ethnic Disparities in Healthcare. It was published by the National Academy of Sciences, and now this study is years old. And so the conversations in which we find ourselves now with COVID just really highlight issues that we have not addressed or have addressed very poorly. And it came to my attention to speak to it as a part of an article that I was asked to write